Hello and welcome to the Microscopic Diaries. It's me, Aigul Sadigova, your host. Today we are shining a light on a hidden threat right here at home, Chagas disease. Once thought to be a tropical concern confined to Latin America, this parasitic infection has quietly established its presence across the United States. According to the CDC, the infamous kissing bug, the vector that transmits Trypanosoma cruzi, has now been found in 32 states, especially in those and southwest, like Texas, Arizona, California, and Louisiana. So today we're digging deep into what Chagas is, how it spreads, why it matters right now, and what science is doing about it. Chagas disease was first described in 1909 by Brazilian physician Carlos Chagas, one of the rare scientists to discover not just the parasite but also the insect vector, the transmission cycle, and the disease's clinical manifestations. The culprit is Trypanosoma cruzi, a hemiplegic protozoan parasite. It is a complex life cycle. The parasite has two hosts, insects and the human cell. In insects, the kissing bug or tetramin, it develops into infective trypanomastocysts in the gut. When the bug feeds on blood, it defecates nearby, leaving parasites in its feces. Through scratching or contact with mucosal membranes, the parasite enters the human body. Inside human cells, it transforms into a mastocytes, replicates, and bursts back into the bloodstream as trypanomastocytes, spreading to new tissues. But how does this parasite actually move between bug and human? To enter that, we need to follow its journey of transmission. Most people think of kissing bugs when they hear about Chagas disease, but there are multiple transmission routes. Vectorial, the classic kissing bug route, still dominant in rural Latin America. Congenital, from an infected mother to her baby, accounting for thousands of new cases yearly. This risk is approximately 5% overall, higher with heavy parasite loads. Blood transfusions, once a major problem, now largely controlled in the US, Europe, and Latin America due to blood screening. Organ transplantation, especially risky with infected heart donors. Oral transmission, increasingly reported in Amazon regions. Contaminated juices, food, or even raw meat from wild animals can carry parasites. Outbreaks in Venezuela and Brazil have shown that oral transmission can cause severe, sometimes fatal, acute infections. Laboratory accidents, rare but documented when handling cultures. Okay, now we know how the parasite entered the body, but what happens next? Let's look at the symptoms and how this disease unfolds inside us. Chagas disease unfolds in two phases, acute phase and chronic phase. Acute phase lasts around 4 to 8 weeks, often silent, but symptoms can include prolonged fever, swollen lymph nodes, liver and spleen enlargement, and the classic Romanos sign, swelling around one eye. Oral outbreaks tend to cause much severe disease, with heart inflammation and even digestive bleeding. For newborns infected congenitally, signs may include prematurity, low birth weight, or severe illness like hydrops fetalis. When it's in chronic phase, we can see Chagas cardiomyopathy, irregular heartbeat, conduction blocks, dilated heart, stroke, heart failure, or sudden cardiac death. In fact, sudden death may be the first symptom. And we can see symptoms in digestive system. We can see megaesophagus, difficulty of swallowing, aspiration, weight loss, and megacolon, severe constipation, and intestinal obstructions. Patients might suffer both heart and digestive forms simultaneously. Knowing how devastating this disease can be, you might ask, just how big of a problem is this worldwide? Globally, an estimated 68 million people are infected, with about 30,000 new cases and 10,000 deaths each year. In Latin America, Bolivia, Argentina, and Paraguay carry the highest burden. The economic toll is staggering. Over $8 billion in annual losses worldwide, including healthcare costs and productivity losses. Yet, fewer than 10% of infected individuals are diagnosed, and only approximately 1% receive treatment. If it's this widespread, how do we actually detect and treat it? Diagnosis depends on the phase. If it's acute phase, parasites can sometimes be seen in blood smears or detected by PCR. If it's chronic phase, it requires positive results on at least 2 different antibody tests. If you have been diagnosed with Chagas, your doctor will discuss treatment options. Antiparasitic medications are the standard treatment try to kill the parasite. Usually benzonazole or nifurtimox are used in this treatment. For acute cases and for children with Chagas, treatment is highly recommended and can cure the infection in most cases if given early. In chronic cases, especially in adults, treatment can still be beneficial. It won't instantly reverse existing heart or digestive damage, but it can prevent the infection from getting worse and may reduce future complications. The course of treatment typically lasts about 2 months with daily pills. Your doctor will explain possible side effects, which can include rash, neuropathy, or appetite loss, and will monitor you during therapy. It's important to note you cannot treat Chagas by yourself with home remedies, and currently no vaccine exists to prevent it. If you suspect Chagas, avoiding delay in professional medical care is crucial. The sooner you confirm the diagnosis and start proper treatment, the better the chances of eliminating the parasite and avoiding long-term problems. So, we today opened the door to a hidden threat that stretches from Latin America to the US, from mother to child, from insect to bloodstream. If you found this episode eye-opening, share it with a friend, and let's keep shining light on the diseases the world too often ignores. Until next time, stay curious, stay kind, and listen to your gut.